How big is America's fentanyl problem? Why is fentanyl popular in the United States? The drug problem has always been a global problem, but the attitude of some countries, regions, to the drug problem is often surprising. For example, the legalization of marijuana in Canada has been subject to international controversy. Well, the United States, which is also an American country and is adjacent to Canada, the abuse of fentanyl-like substances has become a public health problem, and has even become a public hazard. America behind fentanyl. According to Wikipedia, fentanyl is a synthetic opioid painkiller. It is suitable for analgesia after and during various pain and surgery, gynecological and other operations. It is also used to prevent or reduce delirium after surgery. It can also be used in combination with anesthetics as an adjuvant drug for anesthesia. It is compatible with droperidol. It is used as a stable analgesic for large-scale dressing changes and analgesia for minor operations. The drug rehabilitation doctor said, fentanyl drugs, also known as planning drugs or laboratory drugs, are the third generation of drugs that are popular in the world after traditional drugs and synthetic drugs, and are also called new psychoactive substances. Fentanyl was developed by Johnson & Johnson. At the earliest, this drug was developed by Dr. Paul Janssen, the founder of the Belgian Janssen pharmaceutical company, which is well known to the Chinese public. Keynote 1. In 1960, Dr. Paul Janssen proved on the basis of pethidine and synthesized fentanyl, an analgesic drug with stronger analgesic effect than morphine and fewer side effects. Keynote 2. In 1974, Dr. Paul Janssen synthesized sufentanil. Keynote 3. Alfentanil was resynthesized in 1976. Keynote 4. Remifentanil was synthesized in 1990. Drug rehabilitation experts emphasize, the common feature of these drugs is that every progress has a great improvement in pain relief effect compared with the previous one. Fentanyl abuse can be deadly. The drug rehabilitation doctor said, fentanyl was originally used for clinical analgesia and anesthesia of patients, but because it can activate opioid receptors, mainly mu1, mu2, and delta receptors, in the human body, it has euphoric and comfortable stimulation effect. The potency ratios of fentanyl, sufentanil, and remifentanil are 112 and 1:1.2. Now, another derivative of fentanyl, alfentanil, is more potent, 100 times more potent than fentanyl, 5,000 times more potent than heroin, and 10,000 times more potent than morphine. As long as 0.02 grams, it is enough to kill an adult. Opioids, fentanyl is also one of them, are deadly. Just like bright and beautiful mushrooms, the more colorful they are, the more toxic they are, and the faster they die. Why is fentanyl addictive? Drug rehabilitation experts say that the principle of action of fentanyl is similar to that of opioids, and it is an exogenous opioid substance. Opioids, also known as happy substances, produce analgesic, anesthesia and feelings of pleasure, euphoria, and excitement by binding to opioid receptors in the body. However, when exogenous opiates such as fentanyl enter the human body, it will make the endogenous pleasure substances lose their competitiveness, causing people to rely heavily on exogenous pleasure substances and become addicted due to dependence. That is to form a reward system for spirit and feeling. This is actually a manifestation of matter conquering and controlling human beings in turn. When fentanyl is overdosed, it starts with drowsiness, confusion, and nausea, followed by addiction, low blood pressure, and finally death from being too happy to breathe, respiratory depression. Why is fentanyl popular in the United States? The abuse of fentanyl-like substances has become a public health problem in the United States, and has even become a public hazard. Americans say that the key reason for the proliferation of fentanyl in the United States is that it is simple to synthesize, too many types, low in price, easy to transport, and powerful in effect. According to statistics, only 6 fentanyl-like substances were discovered between 2012 and 2015, but among the new psychoactive substances discovered in 2016, fentanyl-like substances increased to 66, becoming the fastest-growing opioid drug. Americans speculate that because fentanyl is cheaper than heroin, and it is used in a small amount but takes effect very quickly, and it is easier to transport than heroin, it is likely to become the king of the new generation of drugs in the United States. Even U.S. President Trump has called the opioid crisis a health emergency, a national shame, and a human tragedy. Fentanyl data in the U.S. The rise in drug overdoses and suicides in the United States is accelerating, according to the Centers for Disease Control and Prevention, CDC, and the two causes of death have combined to lead to a decline in American life expectancy for the second year in a row. Statistics show that the number of deaths due to drug overdose in the United States increased from 63,632 in 2016 to 70,237 in 2017, an increase of more than 10%, of which fentanyl accounted for about one-third of the deaths. Huntington, in the northwest corner of West Virginia, on the border with Kentucky, has been dubbed the epicenter of the opioid crisis. On August 15, 2016, 28 local people died of an overdose of heroin containing fentanyl. The drug is used to treat severe pain but is increasingly being sold on the streets, often mixed with heroin or other drugs. The economic forces stimulating drug production here are powerful. It takes $5,000 to produce 1,000 grams of fentanyl, and the million pills sold at $20 each have a gain of $200,000. And drug use is not discriminated against in this area. Steve Williams, mayor of Huntington, West Virginia, said, "Our youngest drug user is only 12 years old, and the oldest is 77 years old." In 2015, West Virginia, New Hampshire, Kentucky, Ohio and other states had the highest proportion of drug deaths in the United States. In several states, the death rate per 100,000 people is above 28, including 41.5 in West Virginia. How to avoid fentanyl addiction. In the drug rehabilitation hospital where the editor works, the main advice given by professional drug rehabilitation doctors to prevent fentanyl addiction is, use painkillers with caution, never use painkillers from informal channels, and explain the relevant medical history to the doctor in detail before taking medication. If fentanyl must be used as a last resort, it must be prescribed by a doctor to prevent abuse. In fact, in recent years, Sino-US anti-drug cooperation has been going on, but the US always does one thing before others and another behind others. According to the International Drug Control Blue Book, International Drug Control Research Report, 2020, in 2003 China and the United States established a drug control cooperation intelligence exchange mechanism, and drug control cooperation has also become an important agenda for the first round of China-US law enforcement and cybersecurity dialogue in 2017. In 2018, Foreign Ministry spokesperson Geng Shuang pointed out that at the China-US Anti-Drug Intelligence Exchange meeting held in October last year, China notified the US of more than 400 pieces of information on the purchase of fentanyl. China's law enforcement agencies are also actively investigating clues on the trafficking of fentanyl-like substances notified by the US and feeding them back to the US in a timely manner. Deploy all localities to strengthen the collection, analysis, research, and judgment of suspicious samples. Cooperate with customs and postal services to increase the investigation of suspicious postal parcels flowing to high-risk areas such as the United States at key ports, strengthen the supervision of the logistics delivery industry, and promptly detect and crack down on illegal activities. In December 2017, under the careful organization and coordination of the Narcotics Control Bureau of the Ministry of Public Security, and with the strong assistance and cooperation of Shanghai, Jiangsu, and other provinces and cities, the Public Security Bureau of Xingtai City, Hebei Province mobilized more than 100 capable police officers. After more than 3 months of arduous investigation, traveled tens of thousands of kilometers, started with a phone number notified by the Guangzhou office of the Immigration and Customs Enforcement Bureau of the U.S. Department of Homeland Security, successfully cracked the case of smuggling fentanyl and other drugs, and seized 11.9 kilograms of fentanyl, alprazolam and drugs 19.1 kilograms. This case is the first fentanyl smuggling case jointly successfully cracked by China and the United States. In the anti-drug cooperation between China and the United States, China has made great efforts, but the US government has repeatedly forcibly blamed China in order to cover up its own ineffective supervision. Former US President Trump accused fentanyl and other opioids in 2018 as mainly coming from China. He tweeted, "It is outrageous that toxic synthetic heroin fentanyl is being poured into the United States through the postal system from China. We can, and must, let it end now. The Senate should pass the stop bill to firmly end this. Drugs are killing our children and destroying our country. Can't wait any longer." The China Economic and Security Review Committee of the U.S. Congress issued a report in August 2021, claiming that the cooperation between the Chinese and U.S. authorities in dealing with the fentanyl issue was limited and that there were limitations. Operations and U.S. requested inspections and law enforcement assistance have been less cooperative. In December 2021, U.S. President Biden signed an executive order to impose sanctions on 25 entities and individuals in China and Latin America, including 4 Chinese companies, on the grounds of suspected smuggling of fentanyl or related production materials into the United States and 1 person. In fact, in April 2019, China included fentanyl-like substances in the supplementary catalog of controlled varieties of narcotic drugs and psychotropic substances for non-medical use. Liu Yuejin, Deputy Director of the National Narcotics Control Commission and Anti-Terrorism Commissioner of the Ministry of Public Security, stated in August 2019 that there are 25 types of fentanyl-like substances listed in my country, exceeding the 21 kinds controlled by the United Nations. Our country is regarded as a drug, subject to strict control. The spokesperson of the Chinese Embassy in the United States pointed out in September 2021 that despite China's great goodwill and sincerity, great efforts, and sacrifices, some American politicians and media continue to hype that American fentanyl mainly comes from China and Chinese fentanyl precursors flowing into the United States via Mexico and other false content are completely irresponsible and contrary to objective facts. As the country with the most prominent fentanyl problem in the world, the United States is also the largest producer and user of fentanyl-like drugs in the world, but it has not yet formally listed fentanyl-like substances. The reasons for this are worth pondering. The spokesperson told the U.S. side that the root cause of the problem of fentanyl abuse lies in itself, and blaming others will not help solve the problem. The United States must not thank China for its support and help on the one hand, but on the other hand try to accuse and slander China and intensify negative hype. This is really a wrong way to set up obstacles to cooperation. Fentanyl has been blamed in part for the dramatic decline in American life expectancy over the past 3 years. Just 2 milligrams of fentanyl, the amount on the tip of a pencil, is enough to kill. The animal tranquilizer xylazine is now fueling the crisis. It's often combined with fentanyl, with horrific effects that can lead to visceral flesh-eating abscesses, leaving addicts groggy with loss of muscle sensation. According to a report on the U.S. Food and Drug Administration, FDA, website on the 2nd, Dr. Marta Sokolowska, Deputy Director of the Center for Substance Use and Behavioral Health at the Center for Drug Evaluation and Research, pointed out that the overdose crisis has become one of the most devastating public health crises affecting the United States. More than 107,000 drug overdose deaths occurred during the 12-month period ending August 2022, according to provisional data from the U.S. Centers for Disease Control and Prevention, CDC. Death toll surges in recent decade, affecting teens, babies. Fentanyl deaths in the U.S. surged in the 2010s, initially when 2,666 Americans died from fentanyl overdoses. By 2016, that number had soared to 19,413. The COVID-19 pandemic has made things worse, with a record 72,484 deaths in 2021. In 2021, there were 5,622 fentanyl-related overdose deaths in California, nearly 225 of them in teens as young as 15, official figures show. The U.S. news website Daily Caller reported on the 5th that the epidemic of fentanyl and other drugs is harming babies, both after birth and in the mother's womb, with fatal consequences in some cases, leading to difficulty in recovery in other cases. Babies exposed to narcotics can experience neonatal abstinence syndrome and severe withdrawal symptoms, experts say. Potent drugs such as fentanyl pose a greater threat to America's youngest victims, many of whom do not survive, said Derek Maltz, former head of the D's Special Operations Division. Down. Fentanyl has been the most destructive drug in U.S. history. In addition to causing record levels of death in children under the age of 14, unfortunately, infants are also being exposed to this toxic substance, Maltz said. According to a study published by the National Institutes of Health, NIH, there is a diagnosis of neonatal abstinence syndrome every 25 minutes in the United States. Drug epidemic crisis spreads across U.S. states. The numbers are staggering, but the statistics of drug overdose deaths don't quite convey the crisis America is suffering. From Washington to Massachusetts, Louisiana to Philadelphia, fentanyl and sedative user zombies have fallen on needle-strewn streets, laying bare the crisis afflicting the entire nation. Washington state ranks third in the U.S. for illicit drug use, and narcotics like fentanyl appear to be spiraling out of control among the state's drug users. Drug overdose-related deaths in the state surpassed 2,000 in 2021, a staggering 66% increase from 2 years ago. Last week, officials in Washington state made a shocking announcement, morgues and crematoria have run out of space as drugs run rampant in local communities. In 2021, a Seattle court struck down a law that made possession of hard drugs, including cocaine, meth, and heroin, a felony. Now, the crime is considered a misdemeanor, and social critics say it's a big reason for Seattle's current problems. In Philadelphia, Pennsylvania, xylazine, or the tranquilizer, was found in more than 90% of fentanyl samples. It often creates wounds and abscesses, so much so that skin and soft tissue injuries in Philadelphia emergency rooms have quadrupled in the past 3 years. The streets of Philadelphia are littered with orange needle covers that people throw away after injecting drugs, where drugs are used and passed on in full view. Accidental drug overdose deaths rose in Philadelphia, reaching record highs in 2021. A man is completely in control after taking drugs on the streets of Philadelphia, USA. Fentanyl has killed tens of thousands of Californians in recent years. Of the 5,622 fentanyl-related overdose deaths in 2021, nearly 225 were among teenagers as young as 15, according to official figures. In January, the Senate introduced a bill that would require all K-12 schools to provide the antidote naloxone on-site in the event of a fentanyl overdose at school. Greater Sacramento, California, Placer County saw a 450% increase in fentanyl deaths between 2019 and 2021. In 2021, more than half of the related deaths will be under the age of 25. As a result, targeting schools with antidotes has become a priority for the state. California Governor Gavin Newsom announced the move as part of a $97 million spending budget to address the opioid and fentanyl crisis, saying, "This is a top priority." London Breed, the mayor of San Francisco, California, said earlier this year, "Fentanyl continues to disrupt and destroy life in our city, and while the number of overdoses has declined, it remains far too high." Yet throughout California, the current law only imposes 2 to 4 years in county jail for those who possess fentanyl for the purpose of selling, while the suspects of trafficking fentanyl can be sentenced to up to 9 years in prison. The number of annual seizures in the United States is enough to threaten the lives of all Americans. Just a few weeks ago, DIA's special agent in charge Brad Byerly revealed that overdoses and drug poisonings were occurring in children as young as 12 years old. U.S. Drug Enforcement agents seized 379 million doses of potentially legal fentanyl in 2022, enough to kill every American. The DIA said it seized 50.6 million counterfeit prescription pills laced with fentanyl and 10,000 pounds of fentanyl powder last year, which it said equated to more than 379 million potentially legal doses. Because of its low price and relative ease of production, it has replaced prescription opioids and heroin in the illicit drug market. It was the leading cause of more than 107,000 overdose deaths in the United States from July 2021 to June 2022, according to official figures. The deadly man-made opioid, which accounted for a fraction of overdose deaths a decade ago, is now the deadliest drug threat facing the United States, the DIA said.